Okay, everyone, welcome to the Wednesday, April 22nd briefing. Just some brief information for you. Not a whole lot of new things to share. But we're at 9:58 today. It's plus 23 from Monday on the confirmed cases. Unfortunately, it's sad to report another 11 deaths since we last spoke on Monday. So we're at 39 right now. The health system update, we've had 168 COVID-19 patients that have been discharged from the hospital. So that's great news. We love to hear about that. And the senior care facilities, we've had 118 positive cases associated with the senior care facilities. And, you know, if you look at this, you know, the charts here, and you can bring up the first chart there, actually. You know, you can see that the deaths here are clearly from those 70 above. So those residential care facilities are a great concern to us. We are, you know, working with those facilities. We visited 16 of those facilities over the past weekend and assessed them. And we'll continue to assist in those again and provide resources. It's not our responsibility, but we're providing resources to those facilities nonetheless, because it is such a great concern to us. When you have, you know, I think 31 of the 39 who were 70 and above who passed away, clearly this is an area that we need to focus on. I'm not saying they all occurred at a residential care facility, but clearly that's where our seniors are, and that's clearly where we need to focus. And we will continue to focus in the future. Testing remains constrained, but we've had good conversations about trying to increase that. We'll continue to try to increase that. I guess, and that really comes down to not a function of the ability to do that, but really the kits. And we're working on that. We think that we potentially have made progress there, and we hope in the future to be able to really provide a wholesale testing from Beerley at the event center, whether symptomatic or not. But that will remain to be a function of the test kits. So I guess the thing that we did want to report is that health is working on getting the demographic data of positive cases by zip code. So that will be hopefully available next week. Again, you know, I just can't stress this enough. It is unreliable information. It doesn't even begin to tell the story when you have potentially 30 to 50% of the population being asymptomatic, yet spreading it, or have light symptoms, fatigue, a headache, something along those lines, where people are not getting checked. This just tells you a fraction of the story, and we would just hate for people to rely on the small portion of the story, and those are the ones who tested positive. It will be again done by zip code. The youth outreach, the CDC Foundation to fund $100,000 for the youth campaign. That's terrific. Face coverings, as you know, became enforceable today at 8 a.m., which is you know, something that someone can, that now it's enforceable, so someone can be cited or even arrested if they continue to fail to wear a face mask while in public at one of those essential businesses that they're at. Again, if you're exercising, you don't have to do it. The county communications teams has created multiple signs for essential businesses announcing the face coverings. The posters can be downloaded. You can see them here at www.smcgov.org. And note that they are in multiple languages. It's terrific. You know, I've seen signs that say, you know, no mask, no service, or no face covering, no service. Again, it does not have to be a mask, but a face covering, and it can be homemade or otherwise. But just being, you know, out and about, seems like most people have that message and have adhered to that message and are using those safety precautions. So we greatly appreciate that. The volunteer update, the website, we've got almost 1,900 volunteers right now. And the county volunteer website is now live, and the volunteer database is expected to launch on Friday. So SMC volunteers have referred 257 to help Second Harvest Food Bank distribute food to elementary school in Redwood City. And we certainly appreciate that, and they can really use the help. I mean, they're just overwhelmed with requests for food. The lines are long. There is increasing demand as time goes on here. So we are just very thankful to those volunteers who have stepped up and continue to help out with their free time. Okay, now let me get to some of the media questions that we have. And first one, do you have the numbers of the tests provided each day at the event center site? Verily does provide these on a regular basis, but not every day. Those numbers do fluctuate. I know they've been as low as 50 and as high as probably 150. And they fluctuate every day, but you know, not everyone who makes an appointment shows up. Again, now law enforcement, first responders, fire, paramedics, those in the healthcare industry, those who work in the healthcare industry for like senior living facilities can go on demand to those locations and be tested. And we do hope that, you know, if we do increase the amount of test kits available, that people do avail themselves of those services. It's something that we hope to get better numbers on. Has there been progress in providing additional support for contact tracing for those who test positive? We're really putting together a small army. You know, I think we have 50 now here in the county, but we're going to need a much bigger force than that if we when we open up, when we start to open society back up. This will be key. You know, in every area that we've seen around the world, the contact tracing and the testing is vital information that's needed as you open back up, so you can judge how you're doing and what you're doing, and if there's any hotspots. So we'll continue to do that. We are looking right now to create probably a force of several hundred, and you know, we'll look certainly to our resources here and to the resources of workers, government workers around the county that may be able to assist, and this may become their full-time job for you know, a prolonged period of time, a year or more. So we want to identify those people, we want to train those people, and we want to get that in place before we start to open again and get services going to a larger segment of society. Who are the working groups for reopening, and what are they looking at? So like the governor's office, we're looking at a number of criteria, including some of the things I just talked about: our ability to contact trace, our ability to test. The numbers look good. The availability of ICU beds. You can see that ICU beds are, you know, really only at 26% capacity. We've only got 73 ICU beds in the county. You know, that's, you know, and this is without really a surge, you know, so that's something that's a little bit concerning. Not that we couldn't scale those or use outside resources for those, but you know, that is certainly a little concerning. And it's not that those are all COVID patients. We've got regular patients who need those beds also, who have a heart attack or heart surgery, open heart surgery, or stroke, or any of those type of things. So those are the things that we have to get comfortable with. Clearly the surge space is terrific. The ventilators are very good. I think we have more of those on the way in the county. So that's all looking good. And then we have a variety of folks on there, representatives from cities that can represent those cities, elected officials, city managers, who are really kind of tell us what they're seeing in their cities. And we're working with IEM to help us with really the plan. And certainly the health officials in the Bay Area are talking. I think that's not a surprise to anyone. We've heard that reported widely, that they continue to talk about what that looks like. Once reopening begins, what type of business would be reopened first? Small offices, restaurants? Really have no idea. I mean, we're gonna have to wait and see how that pans out and what is successful. I can't say this about that though. It'll be anything but business as usual. You know, I can still, certainly we're going to have to inculcate this thought of social distancing and making sure that we wear masks and making sure that we wash our hands and sterilize things, and that'll be the new norm for the foreseeable future. And we got to make sure that everyone, and I got to tell you, people are doing a great job of that now in markets where they're sterilizing the carts and letting limited people in at a time, and people are standing back 6 feet from one another, and everyone's wearing a face mask. These are the things that I think that will be absolutely essential as we go on and reopen society. More to come on that. Who knows when that'll be or what that'll entail or what businesses will be involved in that, but that is still all being worked out now. Has there been progress on trying to provide city-by-city zip code data? We talked about that. Hopefully it'll be next week, in the latter part of the week. And where are the hotspots right now? There certainly has been focus on nursing homes. Are they one hotspot? Absolutely. The residential care facilities that we've talked about in the past are a hotspot. We want to make sure that if we see anything in there, we're prioritizing testing in those facilities, and we're dropping services in as necessary. We're assessing them as necessary. Again, it's a state responsibility. We are a county resource doing that for them, as we understand, rightfully so, that their resources are taxed at this point in time, and they do not have the capability of being everywhere in the state at once. So we will continue to help out as needed in those facilities and provide the resources necessary to make sure that we properly assess them and that they get the help necessary. With that, Michelle, am I missing anything?
No.
Okay.
We don't have current, we might have one in the chat. Our volunteers sought for the contact tracing initiative.
I'm sorry?
Our volunteers, are we thinking about using volunteers basically?
Yeah, we certainly could do that to the extent that volunteers are available for that. I think that, we have such great volunteers now because a lot of people are off work and really looking to fulfill their time in a meaningful way. And we very much appreciate that. As things start to open, we hope that we still have volunteers come forward, but we need a commitment, at least with government employees, that we know that we can sustain that commitment and ramp up as necessary. We have the resources available right now that I can deploy and really form a new department if that was what was required to do so in order to, and of course that would be through health, leading the charge on that.
Okay, next question is from Henrietta. You've been unmuted.
Thank you. I have two questions. Number one, while the zip code data will be forthcoming next week, do you have any idea what areas of the county might be generating the most cases or where the most cases might be coming from?
Henrietta, I have no idea. I have not seen the data. I have no idea what that looks like. I'll be seeing it for the first time when I report it out to you, really. So I look forward to that too. But again, I would just caution, and I don't want to sound like a broken record here, that don't put too much faith in this. Don't read too much into it. It's really, in my eyes, really useless information, because there's so much more of a story behind it, in that we know that many, 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 many more people in the community have it than have been tested positive for it. So I just don't want to give a false sense of security or insecurity out there, because it's more prevalent in one place than another.
Sure. Now, my second question, you mentioned that 168 patients have been discharged. Will the county be providing any follow-up studies in terms of the cases? For example, it's my understanding that those who've been on ventilators might have post-traumatic, might have some health problems because they've been on ventilators, and people might have emotional and physical problems as a follow-up, for example, liver damage or kidney damage. So will the county be doing any follow-up with released patients?
That's a good question. I don't know, Peter, do you have any thoughts on that?
Yeah, so the follow-up should be with their primary care physicians, that these people who are recovering. And part of the data set that will be released next week will also be those who've recovered. And so it's hard to say, like Henrietta said, there might be this and might be that. And so I think it's going to be incumbent on the primary care physicians that these recovered patients will be staying with, that we would find out from them. But the county's not going to have any specific effort.
Yeah, and you bring up a good point, because I don't think we yet know what the long-term effects of this disease can be, because it's so new, right? And I think that it'll play out over time, and we'll learn more from science as time goes on, and we look at some of these studies and see, not only in this county, but holistically, excuse me, what are some of the impacts of this long-term, much like we've done with other diseases and other events throughout our history.
Just as a brief follow-up question, are the primary physicians required to report the information that they might be collecting? But are they required to report it to the county?
No, they're not. No, that would be private information.
So you might not get the information.
That is absolutely true. I mean, I think we're going to have to really wait for scientific studies to come out to see more, again, what the widespread impacts of this will it be, lung problems? Will it be emotional PTSD problems? Will it be, liver issues? I mean, all good questions. I just don't know what some of those side effects will be at this point in time.
Thank you.
Question from the chat. Santa Clara County found its first death associated with COVID was actually earlier than initially reported. Is San Mateo County planning to re-examine the timeline of reported deaths linked to the virus?
Yeah, I mean, it's something that we could take a look at and ask our coroner to determine if we've had any deaths. I think that the one in Santa Clara County, or the two, were folks that died at home rather unexpectedly, and they went back and did tissue samples testing. I think that it's something that I could certainly ask the coroner, our coroner, to determine if we've had any cases like that in the past.
Is there an update on the effort to place homeless people in hotels? What's the latest number of homeless folks being housed in hotels, and how many hotels?
Yeah, good question. So we do have a hotel that we have recently acquired in our inventory, and that I think we have the ability for 80 rooms there. Right now, I think we've got 8 of them used with 10 clients, and this was, I think the group here at the EOC did a terrific job. I think we got the hotel under contract on Sunday night or Monday, and they turned around and started moving people in on Tuesday. So there's wraparound services there. It's it's really rooms are being used as a shelter. This has really been turned into a shelter with 24/7 staffing. And we do have folks on the waiting list, and the way that it works, and just to let you know, we have 69 folks vulnerable of the homeless in hotels right now throughout the county. We use various hotels. I mean, there's I think 5 or 6 or maybe now 7 hotels that we're utilizing. But it is important to get them off the street and to try to get especially the most vulnerable, and these are ones that are 65 or older with underlying health conditions. It's important to get them out of that congregate living facility and into more of an isolation type of shelter in place situation. And that's what these hotel rooms do. So it's not everyone that gets a hotel room, and I want to be clear about that, but those most in need. So we've gone through the shelter, we've looked at those on our in our continuum of care who really need wraparound services, our whole person care group, and really have determined out of there who needs to be sheltered, and gone through our homeless shelters to pick those most vulnerable and place them. And our folks have done a great job of that. And what that has done is created capacity within the shelter. So anyone wanting to come off the street, we do have capacity in the shelter, and we will get that waiting list cleared of 38 clients relatively quickly.
Next question is from Margie. You've been unmuted.
Yes, I'm just wondering specifically, what are the resources being offered to the nursing facilities, and also for people who have loved ones in those facilities, any advice for them?
Yeah, it's still the best place to have them, unless, you know, they're prepared to care for them at home. But the resources that we're providing is that we've dropped in medical services in to help us do an assessment to make sure that folks there understand how the virus spreads, maybe different setup for them that works better for them, how to don and doff PPEs. And that's the critical part of it, really kind of looking at the sanitation efforts and sterilization and food distribution and all those things where disease can spread. We're offering those services. And again, we've gone in over the weekend to 15 of them and looked at that. And some of these are smaller who don't have, you know, medical personnel assigned to them, like a nurse or a doctor. So we've dropped these services in, again, as a resource. We don't have that responsibility, but we do it as a resource because this is a humanitarian effort. And these are our seniors who live in this county, and we want to make sure they're safe. But go ahead.
I'm just saying that is such a huge increase that we just saw, 11 deaths. Does that concern the health officials there?
Well, I don't know if, you know, where these folks, if they were in residential care facilities or not. But let me just also talk about that and why you see a jump like that. These are reported out only twice a week. You know, I think it's every Tuesday and it's every Friday, and that's because we have to reconcile those numbers with the state. Because someone may live in San Mateo County but die outside the county, say at Stanford Hospital or UCSF or something like that. So we've got to make sure that we take the time to reconcile through the state. The state's acting as a clearinghouse to make sure that we have the right numbers for this county. So we're going to see those type of jumps in that. We're not giving them to you daily. You know, we're not giving it to you every single day. And it's any one of these is a tragic loss to a deadly disease. But to really answer your question, yeah, we're concerned about any congregate setting where people are and the disease is, and that's why we want to make sure certainly these can be handled, and as long as they're the proper precautions that are taking place and the proper PPE, it's probably the best place for them because they're going to get that around-the-clock care that many families cannot provide.
Right. I do have a follow-up, but only it's a lighter question. So when people are finished with the more serious questions.
We don't have any other questions at the moment, so go ahead.
Okay, fashion police question. Your mask, I see you're following the rules. Is that a tie-dyed mask?
It is.
Fireworks?
Yeah, it's kind of that way. So this is what it looks like. It's kind of a different. I've got about 10 different masks that I like to sport different that they go with my accessories. You know, they're kind of an accessory to my suit and tie. So yeah, no, I mean, and you know, we're seeing people get into the spirit of it and really use all kinds of things, and to the extent that we can lighten the mood with our mask and maybe make people smile under their mask, hopefully when we're out in public, you know, we've got to look for the lighter side of this, and there is hope. And I just want to instill all that in all of you, that there's certainly, we're working our way through this. We're a resilient county, we're a resilient state. We've got a lot of great things doing, a lot of great people doing great things. We've got a lot of volunteers who are stepping up. So many people are contributing in different ways, and that's what makes this county so great. All the elected officials working together. You don't have anyone going off in their own direction. All the city managers working together. All the police chiefs and fire chiefs, everyone on board. And those are the things we look to in this time of crisis that really help us get through it. But we will get through it. There will be better days. I just want to give you an example of it. You can't see it, maybe you can't see it, but our libraries, you know, not to be done by Mr. Morris, who I reported on last week, the science teacher who made the face shields. Our libraries, using the 3D printers, are in the process of making 600 of these face shields, which are absolutely terrific, and will provide much needed relief while we wait for the PPEs to get in. And you know, the only reason that they're only making 600 is because they're constrained by the materials that they had on hand. They've ordered more materials, but it'll take a while to get in. But that's the type of ingenuity we talked about, and the contributions that everyone's making. Who would have thought that the library system And a science teacher from Woodside High School would play such an important part in this crisis of providing the tools necessary to treat people in this time of crisis. We are in very unusual times. Okay, with that, listen, thank you all for being on. We wish you all the health and safety, and we'll be back on Friday.